I'm Nurse Valerie with the Department of Public Health, and I'm here to share some important information on how you can protect your family and you from the whooping cough. We'll also hear from a mother whose family was deeply affected by whooping cough. Whooping cough is a respiratory infection. You may also hear people call it pertussis. Whooping cough and pertussis are the same disease. Every year, hundreds of people in Los Angeles County get whooping cough, and in 2010, there were more cases than any other year since at least 1950. Whooping cough can spread easily through the air from a cough or a sneeze. Anyone from a newborn infant to an older adult can get whooping cough, but it's especially serious for infants. Whooping cough usually starts off like a cold. There's runny nose, congestion, coughing, sneezing, watery eyes, and sometimes even a fever. After a couple of weeks, symptoms get worse, and people begin to have sudden, uncontrollable attacks of coughing. A high-pitched whoop may follow the cough, which is why it is called whooping cough. Whooping cough can be serious. Adults and teens usually have milder symptoms, but can still get pneumonia and miss weeks of work or school. Infants can have convulsions, bleeding in the brain, and pneumonia, and can quickly die without much warning. Whooping cough can become serious very fast, but doctors can treat with antibiotics if they catch it early enough. That's why anyone in your family with symptoms that could be whooping cough, especially infants, should see a doctor right away. The best way to prevent whooping cough is to get vaccinated. Infants and young children should get DTaP vaccines at 2, 4, and 6 months of age, between 15 and 18 months of age, and between 4 and 6 years of age. Preteens should get a Tdap vaccine between 11 and 12 years of age, and all teens and adults who have not previously been vaccinated with the Tdap vaccine should get a dose. Both of these vaccines protect against tetanus and diphtheria. Did you know most infants are infected with whooping cough by someone in the family? Let's listen to Dylan's story, an infant who was infected by a family member.
My name's Mariah, and I'm a nurse in San Francisco. I've been here for about 12 or 13 years, and our family is affected by pertussis, also known as whooping cough. And basically what happened is I was pregnant with my second son, and I started to develop contractions about 2 weeks early because I developed a cold. And I was coughing pretty hard. The contractions started, and he was born 2 weeks early. Doctors thought it was a cold. The pediatrician that saw Dylan when he was born in the hospital said, "Your cough sounds really bad. I wonder if you have whooping cough." When he said that, it meant nothing to me. I had no idea what it was about, how dangerous it was. Dylan became kind of lethargic, and I was having a hard time keeping awake when I was feeding him. We went to the hospital to get an x-ray, and he never came home. Every part of his system started failing, and this is within hours. 12 hours later, he was being intubated with the breathing tube. He couldn't breathe on his own anymore. We walked in the room, and we saw them there surrounding him, working on him. And I can't tell you how hard it is to ask a doctor just to stop. And as soon as they stopped CPR, he died right there.
To protect babies like Dylan, everyone who has contact with infants, including parents, siblings, grandparents, and babysitters, should get vaccinated. And if you're pregnant, get vaccinated while pregnant or before you leave the hospital to avoid infecting your newborn. You can get vaccinated at your regular health care provider's office. Don't have a regular health care provider or health insurance? Well, you can visit www.publichealth.lacounty.gov/IP or just simply dial 211 for a list of low or no-cost vaccination providers. Thank you for your time, and remember to take care of yourself and protect your family and you.